India is grappling with a growing health crisis. By 2050, over 521 million Indians could be living with obesity, making us second only to China. Even today, we hold the unfortunate record for the highest number of people living with diabetes globally, with nearly 90 million adults affected. What makes this worse is that these two conditions often go hand in hand, amplifying health risks and complicating treatment. So, what can be done? Is medication enough? Can diet and exercise turn things around? Or is there a more lasting solution? To help us understand the science, the risks, and the real world solutions around obesity and diabetes management, we are joined by one of the most respected voices in the industry, Dr. Aloy J. Mukherjee. With over 28 years of experience, Dr. Mukherjee is a renowned laparoscopic and bariatric surgeon, currently practicing at Indraprastha Apollo Hospitals, New Delhi. His credentials include an MBBS, MS Surgery from Guwahati Medical College. He has done his senior residency and super specialty training at AIMS, New Delhi. He has also acquired fellowships in minimal access surgery and bariatric and robotic surgery and successfully completed the Da Vinci training in robotic surgery. Dr. Aloy is also a privileged member of National Academy of Medical Sciences. With such robust experience and training, he naturally brings deep insight and hands on expertise in minimally invasive and advanced bariatric procedures. Today, we'll explore not just the myths and medical facts around obesity and diabetes, but also the transformative impact that the bariatric surgery can have, from diabetes reversal to improving fertility, joint health, and quality of life. So let's get started. Welcome, Dr. Aloy. We are really pleased to have you today.
Thank you. It's my privilege to be here, ma'am. Thank you.
So, a very common question, but an important one. Let's start with that. Is it common to have both diabetes and obesity at the same time?
Yeah, absolutely. When because these go hand in hand, most commonly they are accompanied with each other, and when they are combined together, we call it diabesity. So what happens is with every ounce of fat gained, your insulin resistance tend to increase, along with increase in some other hormones like cortisol. Now, these are hormones which the body recognizes as, in terms of stress. So basically, so as the insulin and cortisol increases in our body, so, the body goes into a fat conserving mode even more. So that, in turn increases our propensity to have diabetes, even the diabetes even further gets accentuated. So diabetes and obesity, absolutely they go hand in hand, and it's a very common thing. And especially in India nowadays, the Indian population, urban population, we see a lot of people grappling with this, both the conditions together. Most common comorbidity with obesity is diabetes.
Okay. But what are the other conditions that obesity can cause and we should be very, very mindful of?
Absolutely, absolutely. You see, most commonly, it causes a metabolic syndrome. Now, by this metabolic syndrome, what we mean is it causes, disturbances all throughout the body, be it in the liver, the the joints, the stomach, reflux mechanism, all of that. So you tend to have something called a metabolic associated fatty liver disease, which is very commonly seen in patients who have obesity. Along with that, we have obstructive sleep apnea. A lot of snoring happens and apneic spells, waking the patient from sleep. Then we have degenerative joint diseases, especially at the end of the long bones, the femur. So you have osteoarthritis of the knee, low backache, and mental health problems like you can have depression, you can have anxiety, you can have suicidal thoughts. Migraines are very common in obesity. There are certain retroperitoneal tumors, especially in the behind the peritoneal cavity, which are very common, like rhabdomyosarcomas are very common. Urogenital tumors are very common. So, in a nutshell, these are the very common things that accompany. Along with that, you have high blood pressure, hypertension, dyslipidemias. That is again a very common component to this.
That is very helpful, Dr. Aloy. I think you've explained very well from, commonly known problems like high PP to lesser commonly known like sleep apnea. So my next question naturally is, how do you manage obesity? What are and or what is the long term solution?
So basically, no single solution exists. So it is basically a combination of a good balanced diet, regular exercise, behavior therapy, and if these are not good enough, we kind of counsel them for procedures which the patient would eventually require, or the patient, many of them would require. So if normally the guidelines say that if your body mass index, which is a very gross, rough estimate which is taken for obese subjects, if it is 34 and above, along with comorbidities, definitely he or she becomes a candidate for bariatric surgery or obesity procedures. Or even if the patient is overweight, like the patient has a BMI of say 30, 31, or 28 to 30, 31, then also the patient becomes a candidate wherein we can go in for the modern, the lesser invasive procedures like a balloon or a gastric balloon or a swallowable balloon or an endoscopic sleeve. Other procedures can be done. If the patient has a BMI of even lower than that, then definitely the patient can be counseled for other methods of weight loss, like mostly the nutritive part and therapy to help them gain a better mental clarity. Also, maybe induce in them a good discipline, so they can actually do things better. So sometimes, nowadays we have these drugs also which have come in, the synthetic GLP-1 agonists. So in some subjects, selectively counsel subjects of patients who have been screened well, they can be used. Although on a personal level, or I would say these are all level 3 clinical trials, none of them have good substantiated, I would say long-term effects are not very clearly known. So it should be taken with great degree of caution, especially the GLP-1, synthetic GLP-1 agonists, because we would know about the side effects only after 5 years. So, these should be taken with caution. Surgery is a far superior option to losing weight because it causes a natural surge in the GLP-1 rather than artificially induce it. So, I would definitely advise patients who would require the procedure to go for the procedure rather than be dependent on these medications.
So when you say is a far safer, is it? Are we saying because of some data, or it has been practiced for enough number of years, bariatric surgery?
Correct. Very good question, because you see, bariatric surgery has been around for more than 40, 45 years, which is a very good number. So earlier in the 80s, it was done in an open method. It was an open procedure. Gradually, towards the turn of the century, laparoscopy came into vogue. Then there was procedures like a sleeve. Sleeve came, first thing to come was a sleeve, then the adjustable band came. Bypass is one of the oldest procedures, which was done as an open method. Then different modifications of the procedure came in. So surgery, we have level 1 evidence to substantiate surgery. There is, and with level 1 means meta-analysis of data. So there is data beyond any kind of ambiguity to prove and substantiate that this is the platinum standard for weight loss, more than gold. The rest of it, all GLP-1 agonists, the semaglutides, liraglutides, all of these are all clinical trials. We would know more about it in the years to come. Already, Ozempic has come with, in the US, where it was introduced a few years back. Already, it has come with serious setbacks. So, more when we know about it. And there are things like chronic pancreatitis, pancreatic cancers, which have come into vogue with these use of these medications. So, I would definitely advise people who are using this to, a word of caution, because under supervision, even with that, it's very difficult to comment on that.
But the word surgery itself creates a little bit of anxiety. anxiety in any patient. So, if a patient were to come to you and you were to explain what the surgery entails in layman's language, what is it? A short and crisp explanation for our
Correct,
viewers.
correct, correct. Yeah, basically, the commoner procedures. So, the main question which patients ask is, I don't eat anything. So, basically, I'm not eating anything. So, how would I lose weight if you further restrict me? So, it is, see, most important thing to understand is no surgery helps you by restriction alone or malabsorption alone. It is tweaking the hormonal milieu, which we do by certain readjustments in the intestine or the GI tract. Now, unless those tweakings are done, the hormonal surges changes doesn't happen. So there are a few hormones like ghrelin, leptin. Now, those hormones are hormones which the person, we feel hungry because of those hormones. Hunger hormones are those. And there are other groups of hormones like insulin, cortisol, GLP-1. So what it does is basically the GLP-1, which these drugs synthetically induce, this GLP-1 naturally increases, and the cortisol, the insulin, they fall along with a fall in the ghrelin leptin levels. So what happens when these hormones have a reverse role and the glucagon-like peptide increases, which is a hormone for weight loss. So naturally, weight loss happens in the best of forms. More than the restriction or the malabsorption, what it does, it changes the hormonal milieu of the body. So the weight loss happens by the tweaking the hormones. So unless that happens, the patient cannot lose weight. And this cannot be induced by diet, exercises, or domestic control of food alone. You need to do this to the GIT to enable weight loss. So that is why it is so important. And it is done by either robotic surgery or laparoscopic surgery, in which tiny punctures are made. Usually the stay is for 48 hours stay in the hospital and the patient goes home safely in 48 hours. Weight loss starts after 7 days of the procedure and continues for about 1.5 years after the procedure. It's very safe. It is documented and it has been around for more than 45 years in either the open form or the laparoscopic or the minimal access forms. So this is the, like I said before, the platinum standard in weight loss. It cannot be surpassed by anything else.
Right, right, right. But I would assume that even after the surgery, the patient needs to continue with a healthy lifestyle, uh, and not just, feel that, oh, the surgery has been successful. Now I can
Absolutely. This goes
get
works.
away with.
This correct, correct, ma'am. Absolutely nothing works without a good discipline. So we always encourage the patients who undergo a weight loss procedure. They have to inculcate a healthy habit. Most of them, we ask them to get into some form of physical activity after 15 days of surgery. So first 15 days, there is a drop in energy. But the moment your hormones are little, the insulin start decreasing, the cortisol starts decreasing, the energy surges up. There's a surge in energy. And when the energy surges after 15 days, definitely the patient feels more energetic. So they hit the gym, they do physical activity. Eating correct is very important. We have got a bariatric nutritionist with us who counsels them and who are in constant touch with them throughout. So the patient has got this hand holding, we have got this hand holding thing. So, overall, if the patient maintains some discipline, I think this goes in for a very, very long time. And we have got very sustained results. We're doing this for the last 18 years now. No, 18 years now. 2007 we started. So we have got consistent results for the last 18 years.
So, if you can, for our viewers, recollect one or two case studies, uh, who have had profound changes and good changes in their lives because of this bariatric surgery, a slightly before and after
Absolutely.
picture, if you could share.
Absolutely, absolutely. So we recently had, I think last month we did a lady who was heavily diabetic. In fact, they come referred from the endocrinology OPD. The patient was young. She was a 24-year-old lady, and because of the hormonal changes, she was heavily diabetic, a glycosylated hemoglobin of 14.5, and she because of the hormonal changes, she had mental disturbances. She was on antidepressants, a lot of these things, polycystic ovarian disease, and she was always dozing off because of the obstructive sleep apnea. Now we offered her a gastric bypass, Roux-en-Y gastric bypass. Just 40 days after the procedure, the requirement of insulin disappeared. So I got a prescription from the endocrinologist saying diabetes cured. Now this cannot be attained by anything else in life. Her requirement of antidepressants just vanished away. She is playing regular tennis nowadays. She is energetic. She goes to the gym. She eats correctly, and she's a completely changed individual. And added to her weight loss. So over last 1 month, 1.5 months, she has lost about 15, 18 kilograms of weight, 15 to 18 kilograms roughly, which is very good weight loss about in that period. So we would expect about a 70 to 75% decline in the excess body weight for her over the next 1.5 years. And then there was another lady who had polycystic ovarian disease, who was not getting pregnant for a long time. They started this, had this infertility treatment for a long time. Then they decided on for a bariatric procedure, referred by an IVF center. They conceived naturally after 1.5 years or 14 months after the procedure, which is again a very good thing to happen. There was this lady who had come from abroad. She couldn't walk, she couldn't stand. So again, after this procedure, the myopathy or the weakness in the muscles that also improved. She could start walking. So we have got very encouraging results all over. Every patient is an example. And I always ask my patient. We have a small group which is called the Bariatric Support Group, where the patient write their own journals, their life journey about what they were and what they would want to be and how this surgery improved the quality of life. And these results are absolutely tremendous. In fact, we also learn a lot of things from them about how their journey was and where they have gone after the procedure. It is really, really life changing.
So, as I can understand, the benefits far outweigh the risks, if any. But just for our audiences, um, are there any risks, or is there a shelf life for this bariatric surgery that the effects we can see with the next 20 years, and then you might have to do another one or something like that?
Very good question. So, talking of shelf lives, obviously, like I said, it is like your inculcation of some discipline in your life. So we have people who have got on track and they have maintained it that way. Because 6 months into the procedure, you would even not realize that you have had a procedure, because things would have changed so much, and you'd be eating everything normally. So people tend to forget. So they binge on alcohol, they go on astray on a diet. So whenever something like this happens, the balance tilts over. Then they go into a increase of weight mode. So whenever that happens, there are methods of seeing what is the cause of weight increase, and we kind of correct it also. But most people with some discipline, they kind of continue for years to come, many years, many years. And regarding the side effects, since we have some amount of restriction and some amount of malabsorption in these procedures, they would require some iron, calcium, multivitamin, and protein supplementation, which is natural even after 30 to 35 years of age, which normally gives such supplements. So, barring this, I don't think anything much is required in these subjects.
Okay. I'm going to ask a very practical question. Is
Yes.
bariatric surgery covered by medical insurance?
Yes, absolutely. It wasn't covered till a few years back, but nowadays most of the healthcare insurances cover for bariatric surgery. So if you've got a health insurance which is beyond 4 years, most of these private insurance companies do. Uh, there is a glitch with the nationalized insurances. They are a little stingy in this, but otherwise, I think private insurance companies are more benevolent. We've got a good risk cover with them, because this is not a cosmetic
I
procedure.
think that'll be one more. Yeah, I think I agree. I think this will be one more reason if anybody is hesitant that it is covered by medical insurance and
Absolutely.
therefore
Absolutely.
could consider. Um,
And
um,
even if it is not covered, I would
my
like to
final.
add something. Even if it is not covered, if there's one expenditure on your life which a person would want to do, I would say that this money is spent on this procedure, even if it's not covered, they don't have insurances. This is a completely life changing. because you can't buy number of years of your life with anything else. In can you buy anything your life with money? You can't. But this procedure, we gain about 10 to 15 years of your life. 15 years we at
You
least.
answered my last question. I was going to ask you, if anybody is hesitant to go for this bariatric surgery, what would be your one piece of advice? And you actually answered my question. But if you have anything more to say, please feel free. Your final words on this topic for today.
Absolutely, this is something which every patient with obesity must consider, because eventually, with with morbid obesity, with a BMI of 34, 35 and above, we lose years of life and we lose the quality of life, more the quality of life. So, if you have to live well and live away from comorbidities. There's no fun living with diabetes, osteoarthritis, sleep apnea, and all the comorbidities popping in 100 pills a day. So this liberates you, this frees you from all the comorbidities, and you become a completely different individual. The lean individual in you comes out of the shell, and you get liberated. I think that's completely life transforming.
Thank you so much, Dr. Mukherjee, for that really insightful and deeply reassuring conversation.
Thank you,
You have
ma'am. It was
discussed in detail how bariatric surgery has evolved into a safe and really minimally invasive option to actually also narrating the patient's journey. You've shown us that hope and health go hand in hand, especially when expert care is involved. So thank you. And for everyone watching, if you or a loved one is struggling with obesity, diabetes, or both, there is help and there are options. You don't have to wait until it gets worse to take an action. So once again, thank you, Dr. Mukherjee, for your time and guidance, and thank you for to our audience for your tuning in. We really hope today's session helps you take one step closer to a healthier future. Stay well and see you in the next episode.
Thank you. Thank you. It was really very nice.
Thank you, Dr. Aloy Mukherjee, for that insightful and reassuring conversation. From discussing how bariatric surgery has evolved into a safe, minimally invasive procedure, to highlighting the patient's journey. You've shown us that hope and health go hand in hand, especially when expert care is involved. And for everyone watching, if you or a loved one is struggling with obesity, diabetes, or both, there is help and there are options. And you don't have to wait until it gets worse to take action. Once again, thank you, Dr. Mukherjee, for your time and guidance. And thank you to our audience for tuning in. We hope today's session helps you take one step closer to a healthier future. Stay well and see you in the next episode.